You were probably given one or more prescriptions to take following your surgery today. You may get them filled at any pharmacy. Make sure to eat or drink something prior to starting any of your medications. Take all medications with a full glass of water and as directed on the bottle. You may start your regular prescriptions in the evening following your surgery unless directed otherwise by your doctor. Do not take any medications on an empty stomach. If you are prescribed an anti-nausea medication, please take this medication first before starting any of your other medications. This will prevent any nausea that may occur following the surgery or from your pain medication. The most discomfort you will experience is usually 1 to 2 hours after surgery after the local anesthetic has worn off. This will last at least 1 to 2 days following your surgery. Take your prescribed pain medication as needed. You do not have to take it if you don't want to. One prescribed pain pill is not working well. You can add 400 milligrams of ibuprofen along with the pain pill for the first day following surgery. No Tylenol because there is most likely already acetaminophen in the narcotic pain medication that we prescribed you, and we don't want you to take an excess of that. The combination of ibuprofen and your pain medication works better than taking 2 pain pills at a time. It is best to stop taking the narcotic pain medication that you were prescribed as quickly as you can. It is best to alternate 400 to 600 milligrams of ibuprofen with 500 milligrams of Tylenol every 4 to 6 hours for pain. Remember, you do not have to take the prescribed narcotic pain medication if you don't need to. If you were prescribed an antibiotic, start this medication in the evening following your surgery, unless directed otherwise by your doctor. Do not quit halfway. It is always good to take a probiotic while you're taking an antibiotic because it may upset your stomach. If you were prescribed a mouth rinse, start it the next day following surgery. Use the mouth rinse twice a day for the next week to 2 weeks with 3 to 4 warm saltwater rinses in between that. Overuse of the mouth rinse can turn your teeth brown over time. This is not permanent and your hygienist can clean it right off. In order to prevent staining, use the mouth rinse first and brush your teeth right after. Please contact our office for any of the following issues that may occur. Uncontrolled bleeding or pain lasting longer than 6 hours after surgery. Numbness from the local anesthetic lasting longer than 6 hours after surgery. An elevated temperature of greater than 100.5 degrees Fahrenheit. Swelling that begins or increases several days after surgery, meaning it starts to get better, but then it gets worse. You have the inability to open your mouth, persisting beyond 7 days. There is persistent irritation at the IV site. Any adverse reaction to taking your prescribed medications. A bad taste in your mouth that started after several days following surgery. We hope you find these post-operative instructions helpful. If you have any questions or concerns following surgery, please give our office a call. We are always happy to answer any questions you may have.